Hi everyone, my name is Alfie, and I'm the president of the Newcastle University Radiology Society. Today I'm here to highlight what we have done in the past academic year, and hopefully by sharing our ideas, we can create more dialogues on how to get more students interested in this great specialty, and more of us will be inspired to create a diverse and inclusive learning community to disseminate knowledge. So here are the 5 main points in our presentation today. We'll first discuss the history of our society and our mission. Secondly, I will introduce you to members of our executive committee. Thirdly, I will talk about the activities we have organized. And then we will talk about the sustainability plan. And finally, our future plans for the society, including how we plan to spend our prize money. So to start off, we're first going to talk about the history of the Newcastle University Radiology Society. Established in 2012, it began with a collection of local interested students organizing didactic in-person teaching sessions in the Royal Victoria Infirmary. During the COVID-19 pandemic, such in-person sessions were not feasible, and a lot of the teaching were actually suspended. The Society therefore identified a gap in radiology teaching and adopted to our online teaching environment, reaching out to hundreds of students both in the UK and abroad. In the post-pandemic world, however, students continue to show preference for the convenience of online teaching while also demanding the human interaction, the relationship building with their seniors, and hands-on experiences of practical skill. Once again, the Society reinvents itself and aims to be responsive to these needs and adapt to the newest post-pandemic landscape with a mix of online teaching and in-person workshops. These are the goals our Society has set out to achieve this year. We will aim to continue to make the dissemination of knowledge and image interpretation widely accessible to students via a free online platform. We will aim to increase the number of interactive hands-on sessions. We aim to launch a successful mentorship scheme. We aim to host an in-person undergraduate radiology conference to increase the profile and interest of the specialty amongst the medical students. We aim to tailor sessions in response to feedback from our members and the wider student body. And we aim to adopt an inclusive approach to welcome more students into the field of radiology. Thankfully, we have successfully achieved a few of our goals this year. And no success can be achieved without a good team. So here are the members of our executive committee. So first, I have myself, Alfie, in the top left corner. I'm the president. And then we have Roxandra, who's our vice president. And then we also have Henry, who is our treasurer and my predecessor, shown on the bottom left corner. On the top right hand corner, we have Caitlin, who is our secretary. Then we have Dana, who is our welfare officer, keeping an eye out on everyone's mental wellness. And then lastly, we have our newly recruited preclinical year lead, Liddell, in the bottom right corner. And although these 3 people are not in our executive committee, I would like to take the special time out to thank these 3 amazing individuals. They are Jenna, Emma, and Embreen. They are the radiology registrar who have taken a lot of time out to help with organizing activities throughout the year. So thank you. Here's a list of our activities. I split the year into 2 halves. For the first semester, we focus on organizing an online teaching series. For the second semester, we'll focus our energy on in-person workshops and our undergraduate radiology conference. So for our first semester, our online teaching series kick off with the first sessions called Introduction to Radiology. Dr. Emma Chisholm, who's our radiology teaching fellow, talked about what a career in radiology looks like and a brief overview of the many subspecialties in radiology. And then we have chest x-ray, abdominal x-ray, upper limb, lower limb, spine and pelvis sessions. These sessions highlighted the typical pathologies that could be seen in x-ray images. The sessions were designed to educate attendees on learning outcomes listed in our undergraduate curriculum. And then we also have our Risky Survival Guide Radiology Edition. These review sessions wrap up our first semester. The registrar gave out tips and tricks to help medical students to ace their exams in an interactive sessions, engaging students to discuss an efficient format to present their findings. And for our second semester, We focus on setting up in-person workshops, and they all have a common theme: interdisciplinary collaboration. For the first one, we work with Cardiology Society of Newcastle University. We invited Dr. Eggert, who's our honorary consultant electrophysiologist. He demonstrated to students how to hold ultrasound probes and use them to visualize different structures of the heart. Students then had hands-on opportunities to practice their skills on real-life volunteers to consolidate their knowledge and become familiarized themselves with echocardiogram. We also have a session on emergency ultrasound. We invited Dr. Yaman, who is an A&E consultant. He taught attendees how to use ultrasound imaging to guide decision-making. Of course, we also ran our very first inaugural undergraduate radiology conference. Here's a list of our official programs. And we have some highlights for our speakers. We have Dr. Al Zuhair, who is the Northern Radiology Academy Lead and a Quality Training Director. He kicked off the morning with a presentation introducing the specialty and the application process. Then the radiology trainees discussed their typical weekly schedules and how they arrive at their training pathway. We have Dr. Siddle, who is the consultant pediatric radiologist. She introduced students to her specialty and discussed how she has found inspiration to the resilience of children. To break the stereotypical portrayals of radiologists, she also showcased the communication skill and patient interaction required in her daily work. She discussed her inspiration from an article by Dr. Gunderman titled "The Lure of Pediatric Radiology," shown on the top right corner. Then we have Dr. Raika, who's the consultant interventional radiologist. He talked about the past history, present practices, and future direction of his subspecialty. He enthusiastically brought cases from his practice to whet the students' appetite and invited attendees to an abundance of job shadowing opportunities. A copy of his slides is seen on the top left corner. In the afternoon, we have Dr. Tammy Ali talking about his experience working remotely to help patients injured in the Sudanese Revolution in 2018. He discussed how healthcare professionals do not need to travel abroad to support global health provisions. He inspires students to do more to help the less fortunate in other parts of the world. His presentations about the beautiful Sudan is on the bottom picture. After Dr. Ali's presentation, students were split into 4 different workshops to have hands-on experiences with ultrasound guided biopsy on the phantom models, picture on the left-hand side. There's also another workshop showing the equipment used in revascularization procedures in interventional radiology, shown in the middle picture. Another workshop on practicing plain film reporting in small group setting with individualized feedback, picture on the right-hand side. The 4th workshop involved a simulated experience of an on-call shift in interpreting CT head and CT abdominal imaging. And here is a picture of some of our attendees at the end of the conference of that day. We also launched our mentorship scheme successfully. Currently, our medical school curriculum does not have any formal allotted placement with radiologists, so our mentorship scheme attempts to address this gap in experiential learning. The Society launched a mentorship scheme to match participants with registrars and consultants based on the students' expressed field of interest, such as pediatric radiology, interventional radiology, etc. Program participants have opportunities to shadow reporting sessions, obtain one-on-one career advice in building their academic portfolios, and participate in research projects. 9 students were enrolled in this program. And now we'd like to talk about our sustainability plan. In order to create a critical mass of student interest, the Society has maintained a strong online presence via various social media platforms. The Society has been active on Facebook, Instagram, YouTube, and Twitter to announce talks, live workshops, and gave out exam revision materials. We have actively solicited feedback from each participant after our events. And in order to boost the return rate of feedback forms, the Society has set up QR codes during Q&A periods at the end of each session to the feedback link. We made our undergraduate conference free of charge to remove any financial barriers to exploring this great specialty. The in-person conference attracted MBBS students from 2 universities in the Northeast. Newcastle University, and Sunderland University. We have provided students with incentives to attend our event, such as certificate for attendance to help out with their portfolio building. We have also recruited preclinical year students to join the executive committee. The society has fully embraced the motto, "Start them young," and we offer these students leadership opportunities to foster their interest in radiology. As a result of all these, the society has grown our social media following from fewer than 200 participants to well over 1,200 followers on our Facebook page. And finally, we'll talk about the future plans for the society. In the future, we would like to continue to develop more hands-on workshops to help students develop the confidence as well as the competence in image interpretation and radiological interventions. We'd like to create more interactive sessions to showcase different subspecialties not being mentioned in this presentation so far, such as neuroradiology or nuclear medicine. We'd like to build a strong and vibrant learning community to allow interested undergraduate students and junior trainees to develop good professional relationships with senior registrars and consultants. We'd like to continue to collaborate with other undergraduate societies to emphasize the importance of interdisciplinary approaches and to demonstrate the central role of radiology and imaging sciences in the diagnostic and treatment of many medical conditions. We would like to work with local researchers in medical education to develop more effective pedagogical methods to teach radiology in our undergraduate curriculum. And last but not least, we would like to give back to the local community via fundraising, awareness campaign, and charity work such as cancer detection, osteoporosis check, so that we can improve the health outcome of residents in the northeast of England. And finally, last but not least, we would like to thank the Royal College of Radiologists for giving us this award. I would like to thank all my colleagues in the executive committee. I also would like to thank all the registrar and consultants who have devoted the time and effort to make the presentations, run the workshops, and help organize the undergraduate conference. I would also like to thank all the members of the Radiology Society who have embraced this specialty and participated in all our activities. And thank you for listening.